When evaluating groundnuts, peanuts versus cashews for cardiovascular health, groundnuts generally have a slight clinical edge in both their fatty acid profile and the volume of evidence supporting their cardioprotective effects, though both offer distinct metabolic benefits. Fatty acid profile and lipid metabolism. Groundnuts. As legumes, groundnuts possess a highly favorable ratio of monounsaturated oleic acid and polyunsaturated linoleic acid fats. Clinical trials such as the Aristotle study, which is different from the apixaban versus warfarin Aristotle trial, demonstrate that regular peanut consumption significantly lowers triglycerides and improves both total cholesterol HDL ratio and LDL HDL ratios. Cashews contain less total fat than groundnuts but have a relatively higher proportion of saturated fat. However, the primary saturated fatty acid in cashews is stearic acid, which has a well-documented neutral effect on circulating LDL cholesterol compared to palmitic or myristic acids. While some trials show cashew consumption slightly lowers LDL, meta-analyses frequently indicate their overall impact on the lipid profile is neutral, though they do effectively lower triglycerides. It is also worth noting that cashews have a higher carbohydrate and lower protein content compared to peanuts. Vascular and endothelial function. Groundnuts are an excellent source of L-arginine. As the primary precursor for endothelial nitric oxide synthesis, this amino acid plays a direct role in maintaining vascular tone and improving flow-mediated dilation. Peanuts also contain resveratrol and higher levels of vitamin E, offering substantial antioxidant protection against LDL oxidation. Where cashews excel is in their micronutrient density, particularly magnesium and potassium. This gives them a notable advantage in blood pressure regulation. Meta-analyses have consistently shown that targeted cashew interventions lead to statistically significant reductions in systolic and diastolic blood pressure. Epidemiological evidence. Both options demonstrate a strong inverse relationship with coronary heart disease in major prospective cohorts. However, the overall evidence base for peanuts is more robust, largely due to their broader global consumption and inclusion in more extensive long-term dietary studies. So to summarize, for primary lipid optimization, specifically triglyceride reduction and improving lipoprotein ratios, or for endothelial support, groundnuts are the superior choice. If the clinical focus is more heavily weighted toward managing mild hypertension, the high magnesium content in cashews makes them a highly effective alternative.